The truth about vaping. Vaping products have been the most commonly used tobacco product among youth since 2014. 4.1 million high school students and 1.2 million middle school students reported vaping in the past 30 days. Nationally, there have been more than 2,700 vaping cases and 64 confirmed deaths. Students in Sacramento County have questions about the effects and dangers of vaping. They wanted answers from someone they trusted. Dr. Amir Zeki from UC Davis Medical Center provided answers to their questions. During the conversation, Dr. Zeki shares the story of one of his patients, John Thomas.
What are the health effects of someone who vapes?
So people who vape can have a variety of health effects. They can be fairly, minimal or less significant effects, such as coughing or feeling short of breath or having some wheezing, to much more serious effects, such as respiratory failure, where they have areas in the lung that are inflamed, fever, and they get acutely sick. They end up in the hospital or intensive care unit.
What is popcorn lung?
Popcorn lung is sort of the layman's term for what's called bronchiolitis obliterans, which is damage and scarring to the very terminal, small, tiny airways in the lung that causes thickening and narrowing of those airways, and that scarring can be permanent.
What are some of the chemicals found in e-cigarettes?
So some of the chemicals in e-cigarettes can include the base liquids such as glycerol and propylene glycol, but of course there's also nicotine and flavorings that have diacetyl in them as well.
What is an e-cigarette aerosol?
Ultrafine particulate matter, which gets into the very deep part of the lung. They of course include nicotine. They include the flavorings, including diacetyl, which is that toxic compound I mentioned, volatile organic compounds, some cancer-causing chemicals as well, unfortunately, and some heavy metals such as tin, nickel, and lead.
What are some of the short-term effects?
Short-term effects would be, or perhaps maybe side effects, would be things like feeling loss of concentration, agitation, jitteriness, dry mouth, a sense of thirst that can come from some of the side effects of e-cigarette use or vaping.
Dr. Zeki invited John Thomas, one of his patients, to share his story. John is a personal trainer and former military who talks about how vaping affected his life.
I have an experience with lung injuries associated to e-cigarettes and vape.
When he came in, his picture really didn't fit a clear diagnosis. He did have manifestations that looked like severe asthma, and it was a little odd to see that all of a sudden to have severe eosinophilic asthma. But sometimes occupational asthma can be associated with exposure, so we made a provisional working diagnosis and began treating him, and he did have some improvement. But because his picture was so atypical, I kept digging into his exposures and his history.
In 2017, I spent 63 days in the hospital. Not all at once, but nothing was less than a week for the process. They took a camera down my throat and checked both lungs. Nothing came back conclusive.
The patient, when I asked him about smoking, really didn't make the connection, because that's sort of the psychological state of mind, is that I'm not really smoking, I'm just, vaping. And so that connection wasn't made until, I asked the question repeatedly, and then I got to vaping, and then he said, oh yeah, I did do that, innocently, just forgotten. And once he was reminded, he confirmed that in fact that was the case and helped me make that temporal relationship. His version, his manifestations of E-Valley has not recurred since he has stopped vaping.
What is E-Valley?
E-Valley is the name that stands for e-cigarette or vaping-associated lung injury. And this is the lung injury that manifests as a pneumonia-like process on X-ray, fever, cough, wheezing, and respiratory failure, where the patient's unable to maintain their own breathing, and they can often end up in the intensive care unit on a mechanical ventilator.
I take a disc inhaler for treatment twice daily. I also have a rescue inhaler I have almost all the time. I still have to take medication daily, monthly, bi-monthly. With the e-cigarette use, because of how much I was doing with my lungs, it basically took me out of the military. I used to mountain bike ride, hike, camp all the time. Outdoors was my number one place, and now it's not so much of when, it's if. Depends on how I'm feeling. what the weather is, if there's allergies. Go from there to the point where it's like, I can't run a half mile if I even wanted to without falling over with asthmatic attacks. And because of the things I have now, I will never be able to go back to the military.
What advice would you give to youth about e-cigarettes?
Advise people around you to stay away from this stuff.
I would stay away from vaping, cigarette smoke. They're addictive and they're harmful. And that's really the bottom line.
To learn more about the dangers of vaping, please visit www.scoe.net/TUPE. Special thanks goes to Dr. Amir Zeki, John Thomas, Catherine Nunez, Edward Stack, Paisley Dysart, and Aaliyah Bambos. The statistics in this video come from the CDC and the Substance Abuse and Mental Health Services Administration.